Okay, well, we're at the top of the hour. We're going to go ahead and get started. And today's topic is about treating childhood traumatic grief. And I'm going to just do a couple housekeeping items, and I'll let our speaker introduce herself and more of her topic today. So just a couple of housekeeping items. If you would like to ask a question during the presentation, please use the chat feature, which is found on the right side of your screen. And then this is just a reminder that the webinar is being recorded, and we will provide a link to this presentation from our website. And so we did have the first question come in. It's about muting your phone. Everyone on the conference line right now is muted, so you don't need to worry about muting your phone. So I'm going to turn it over to our speaker today, Sapna John.
Okay. Hello, everybody. Welcome. So my name is Sapna John. I'm a postdoctoral fellow here at UAMS. I primarily work with children and adolescents who've experienced traumatic events in their lives, and so I'm excited to be able to talk to you about traumatic grief. I think it's a component of TF-CBT that we don't necessarily get a whole lot of talking about, but we do run across quite a bit in our own work. So I'm excited to be able to present to you on it today. Like Chad mentioned, if you have a question, please feel free to jump in. So in general, what I'm hoping to accomplish with you today is a couple things. So first is just in general, how do we differentiate typical grieving from traumatic grief? And then we'll move into really how is traumatic grief incorporated into trauma-focused cognitive behavioral therapy, and then we'll actually talk about the specific traumatic grief components. And so I'm making a couple assumptions here in that you have some familiarity with TF-CBT, trauma-focused cognitive behavioral therapy. I'm not going to spend a whole lot of time focused on those modules in particular. Instead, what I'm going to do is help you to understand how traumatic grief work fits into the modules as they're currently practiced. Okay, so let's get clear on some terms before we get started. So traumatic loss, as it's defined, is really a situation that is terrifying that results in death. It may have also been life-threatening for the child. And so a couple things to keep in mind is that these deaths can be expected or unexpected. And so for some people on our caseload, with the death of a sudden accident or a violent crime, this is something that was unexpected and really dramatically alters a kid's perceptions of things. Likewise, though, oftentimes expected deaths can be just as traumatic. So let's say a caregiver is diagnosed with a chronic illness and a child understands or perhaps doesn't understand that this is going to eventually lead to death. That can also be traumatic. So instead, what I want us to help do is really focus on the degree to which this event is perceived as traumatic by the child. And we'll talk a little bit more about prevalence rates of traumatic grief, but I always want you to keep that in the back of your mind as how traumatic was this loss for the child. Some would argue really that the loss of certain relationships in your life is always going to be traumatic. So in someone in terms of a parent or someone in a significant caregiving role, some people would say that regardless of the situation of how this happened, this is going to have a dramatic impact on your life, and it's going to be a traumatic stressor for a child. And there are people who will argue both sides of that issue, but it's something I just want us to also keep in mind is the case that I'm going to be presenting on today and kind of bringing in case examples will really illustrate that idea of is the death of a caregiver always something that's traumatic. And then finally, grief in general is feelings of intense sadness and distress from not only missing the person who died, but also changes that have resulted in your life from someone passing away. So before we talk about traumatic grief, I think it's important to understand what is typical grieving. So what does it typically look like to grieve? And we often call that something called uncomplicated bereavement. So basically, we still see intense sadness and longing for the deceased individual. And there is no typical period of time for bereavement. I know in psychology with DSM, we try to put a specific time frame on things to characterize typical bereavement from something that would be over what we would expect it to. But it really does largely depend on so many things. So it depends on cultural values, it depends on individual characteristics, family impairment, And so instead of really looking at a time frame for understanding what differentiates typical grieving from traumatic grief, instead really the defining feature of traumatic grief is that it interferes with the ability for a child to go through this typical bereavement process. And I'll show you a slide coming up that really goes into specific symptoms. But one thing that's really hallmark here is any thoughts or reminders of the person who has passed away triggers maladaptive or difficult reactions. And so in the typical grieving process, eventually what we would hope is that you can remember positive aspects or positive memories of an individual and not have those trigger post-traumatic symptoms. But because of these children's PTSD symptoms, it really gets in the way of them being able to go through this process in a healthy manner. So the symptoms of traumatic grief have a large overlap with PTSD symptoms. So symptoms of avoidance are really avoiding things that would remind the child of the deceased person. And in the case of a caregiver, we can imagine how many things in your life would remind you of this person. So it would be your day-to-day routine and activities. It might be the rooms of the house that you live in. And so avoidance can be a really impairing symptom in PTSD in general, but particularly in traumatic grief. There are the hyperarousal symptoms that we typically see in PTSD that often look like behavioral disorders or behavioral symptoms in children. And then there's the re-experiencing. And in traumatic grief, re-experiencing is additionally complicated because there are a lot of reminders that come up about the person, whether it's death anniversaries, birthdays, significant events that you would have wanted that person around for. But in addition to PTSD symptoms, there also may include symptoms related to grieving, yearning for the loved one, anger at the situation, guilt, or feeling somehow responsible for the death of someone you love. And also in children particularly, there can be the presence of revenge and rescue fantasies. And we're going to talk more about this when we talk about traumatic grief and the trauma narrative, and when we would really want to address revenge and rescue fantasies, and when we might not consider that to be a battle we want to choose, and in fact may actually help be an adaptive response for kids. So what I want you to understand is that childhood traumatic grief is related to PTSD, but it isn't PTSD entirely. So they are two separate things. So when we look at their correlation or the relationship they have with one another, they're correlated pretty highly. But there's still some unique components of each of those things. And so that's really why it's important to do a thorough assessment of these symptoms to understand, even if someone has lost someone, do they really have traumatic grief symptoms? So how do we recognize this in our kiddos? So children with traumatic grief will likely have a considerable difficulty or be unwilling to accept the death of a loved one. Bear in mind, before I continue with these, I think it's important to note, some of these things will be age typical. And so what you're really looking for is age inappropriate levels of these symptoms. They also tend to have really intense and distressing feelings when they're triggered by reminders, which then leads them to engage in a lot of avoidance. They react very strongly to the change or feel overly responsible for the death of someone. Oftentimes they feel quite guilty in forming any new relationships with individuals in their life, and we know how important social support is for individuals, and this can really contribute to the impairment that they have. They avoid all memories of the person, including positive memories, because they often can't think of the person without also thinking of the death and also experiencing PTSD symptoms. They may resist the process of meaning-making of the death. And then finally, they experience reduced engagement in age-appropriate behaviors and relationships. And so you would really see this functionally impairing them, likely, in a lot of different places. You may see them not wanting to spend time with their friends anymore, not wanting to go to karate practice anymore, not really wanting to do the things we would expect children to do. So what we know now in terms of just children who are grieving, potentially, is that in 2007, which is the last statistic that I could find, that over 2 million children in the United States receive Social Security benefits due to the death of a parent. And so what we know is that many children in our country are facing the loss of a caregiver. And that's only a caregiver, that's only a parent. So there's even greater prevalence of loss when you think about siblings, about grandparents, about best friends, about other people that their death would really make a difference in these kids' lives. But there's some discrepancies over how many of these kids actually develop significant PTSD symptoms. What we know about resilience is many children who experience a trauma do not develop PTSD. And likewise, children who develop the death of a loved one wouldn't necessarily develop traumatic grief. But it's a far-ranging prevalence rate. So some people say that most children who have experienced a loss will not develop childhood traumatic grief, while others cite prevalence rates as high as 72% of children who have experienced that loss will develop childhood traumatic grief symptoms. I think a lot of that depends on how you measure these symptoms, how you think about traumatic grief, and perhaps the patient populations that we're really looking at this with. And the patient population matters because there are a lot of risk factors for developing traumatic grief once you've experienced a loss. Previous trauma is one of them, and so experiencing a loss can trigger reminders of previous traumatic incidents in your life, make it even more difficult to feel safe and to feel trusting of your environment. They can also make your PTSD reactions much more intense. Prior mental health difficulties in general, so behavioral difficulties as well as anxiety or depression can really contribute to developing traumatic grief. One that I think is really important for us to address as child and adolescent clinicians is the impaired functioning of parents and the family. So what we know is the level of sadness in the home as well as the impairment of parents and their own PTSD symptoms have a lot to do with recovery of children in general. And it's something we address explicitly in TF-CBT, which is why it's one of my favorite parts of the model, and we do that as well in CTG, or childhood traumatic grief work. Individuals have poor social support or secondary adversities. What we mean by that is, what if the person who passed away was the primary breadwinner or the person who was bringing in the financial resources for the family? Not only are you grieving the loss of someone you love, you're trying to figure out how to pay the bills. And while those might be parent concerns, parent worries rub off on children. And many children will say, you know, I don't know how we're going to pay the bills. They've heard their parents talk about this. They see their parents crying over it. They're not quite sure how to make sense of it. Also, the death characteristics can be a risk factor for developing traumatic grief. So what we know is if the child was also in danger, that does increase the risk of traumatic grief happening, as well as if the death was violent in any way. That can also really, as we understandably, make it much more difficult to process what happened. And finally, the degree of closeness to the deceased. In the case example that I'll talk with you about, this kiddo actually experienced 2 deaths in a relatively short period of time. One death from an individual who he wasn't actually that close to, and another death of a person who he was very close to. And we'll talk about how there might be differences in symptoms because of that. So the typical treatment sequence for how you get into childhood traumatic grief is you actually start with TF-CBT the way we think about it. So you're going to do your practicals, you're going to do the trauma narrative, you're going to do the cognitive processing, and then get into the really directed childhood traumatic grief components. The reason for that is a lot of times, remember, these trauma symptoms are getting in the way of kids being able to go through the typical bereavement process. So by addressing the PTSD symptoms, just like we do in TF-CBT, think of it as freeing the child to then be able to go through these components successfully. And so briefly, kind of how we integrate traumatic grief into the prac skills. So remember, if we're doing TF-CBT, we're using gradual exposure. So what that means is we're bringing up the traumatic event in every session. We're talking about it explicitly. We're not referring to it as that thing that happened. We're referring to it as this person passing away, this person dying. I tend to take my language from the family. And so if the family uses the term passing away, that's what I'll use. If the family uses the term dying, that's what I'll use. But what I won't kind of mimic is avoidance language. And so if it's an avoidant kind of language like, you know, that thing, then we would want to clarify that. So how do we then talk about traumatic grief in the prac skills? So starting with psychoeducation, we would really want to validate the experience they're having, help parents to understand how the current symptoms are understandable given the context of what this child has been through, and help them understand that they're not the only kid who has lost someone that's meaningful to them. And similarly for parents, they're not the only parent who may now be in a single parenting circumstance because they've lost their partner or they've lost their own parent in a circumstance. Then when we get into parenting, typically how we do this is we really give them strategies for managing the impairing behavior that their kids are demonstrating. And remember, disruptive behavior of kids is highly impairing to a family functioning, and we know that family functioning really relates to how these kids get better. So if we're not addressing those problems, not only are we not helping the family get to a better state, we also might be losing our parents. So oftentimes they're coming in because these kids' disruptive behaviors are very impairing, and if we don't address them, we may lose them. And so we want to make sure that we're including parenting as an important component of the prac skills. Next, in relaxation, we're helping both parents and children to feel more in control of their trauma reactions. This is typical to how we would do it in TF-CBT in general. One of my favorite strategies is when we teach the kid, then the kid teaches the parent, and they both practice. Remember, parents are grieving too in most of these circumstances, and so the better mastery they have over relaxation, the more they're able to help prompt their kids to also engage in it and use it effectively as a family. In the affect modulation state, we're really trying to focus on feelings identification. With kids who are grieving, it might be differentiating feelings across context. So what is this going to feel like when you're thinking about this at home? Or what's it going to feel like when your mom brings it up versus what's it going to feel like at school when someone talks about their dad and you lost your dad? And we really want to emphasize here the importance of children sharing their feelings to parents. And this takes some work because sometimes parents may not be in the place where they're able to really hear their children's sharing feelings. I think a lot of us have this experience of working with families who have been through trauma that kids sometimes go quicker and they're able to kind of share these things at a pace that the parents may not be ready for themselves. And so it's really helping support the parents and having them understand that it is important for the kids to share their feelings, even if they're not feelings that are pleasant, even if they are feelings that are pleasant, helping them to understand that we value them sharing their emotions. And finally, cognitive coping is really focusing on shifting unhelpful thoughts to help them be more adaptive. Similarly, in TF-CBT, we would not want to address the specific trauma-related cognitions before doing the narrative, and that's really to make sure that they're actually coming out in the narrative and we can process them appropriately. But as we know, distortions are pretty pervasive, and so most kids, we can find other areas of their life in which they're doing things like all or nothing thinking or overgeneralization, and help them practice this skill. So that way, when it comes time to do it in the narrative, they're familiar with how to restructure their own cognitions with help from adults or even independently. And then we get into traumatic grief and the trauma narrative. So remember, the purpose of the trauma narrative is twofold. It's really a gradual exposure exercise in a lot of ways. So it's helping children to gain mastery, to be able to kind of handle the emotions that come with dealing with talking about these events, helping them gain control of the emotions. But also part of the trauma narrative is helping children to make a different meaning about what they've experienced, to make it be something that's adaptive for them. So as always, it's oftentimes helpful to first focus on the factual accounts of the death and then perhaps discuss thoughts and feelings. So for kids who are jumping in right away with thoughts and feelings, that's fine. But a lot of kids, so my first narrative session with this kid that I worked with, he's a 6-year-old, and he experienced the death of one of his grandparents and his father. So the death of his grandparent was a quite significant criminal act. I'm not going to get into the details because I want to respect confidentiality, but his grandparent died in an event that was shared by the family. But his father died unrelated because of cancer. And so these two events weren't related to one another, but he ended up experiencing deaths within a month of one another. And so when I first asked him to do the narrative, he said, my grandpa died. So I said, what happened before that? Well, he was alive before that. And that was pretty much the extent of his beginnings into the narrative. And so we focused on, where was it? What happened? Where were you? Who was there to get him talking? And then later, through different sessions, he was able then to interject what he was thinking and what he was feeling. what you do is I would typically do the narrative with him and then share that narrative with his parent, and then eventually we'll want the kid to share the narrative with their parent while you're in the room. But we first share this with parents because we want to help them process their own reactions and their own feelings to this event, particularly if they were also involved in the trauma or if they're also grieving. But also we want to help them to be as supportive as they can to their children. So a lot of parents will ask, like, what do I say when this is over? Or how do I show them that I can handle it? And so a lot of it is practicing with parents of how can you be supportive? Because they want to be supportive, and perhaps we can help them with the phrasing or the behavior that would help them to be as supportive as they can. Important to note, as always, the trauma narrative is not a forensic document. It's not meant to be pulled into court cases, and it doesn't need to be a perfectly accurate account of what happened. So this is especially important. As I was sharing this kid's narrative, there were a couple points where mom would say, that's actually not what happened. Like, that's not where we went, or that's not what happened next. And so talking to her about children's memory systems are still forming. So some of them is they're genuinely don't remember things in the same way we do, but also remember that trauma influences your memory as well and how you remember things. And so it's not necessarily important for it to be perfectly accurate, but we would want to address things that are dramatically different or change the story. So, for example, my kids said that at one point because it was a crime, at one point they were hiding in a room of the house. And he said that he put glue all around the door of the house, and he put glue in the lock to make sure that the perpetrator did not enter the room. So this isn't true. So mom, when she heard that, mom was like, no, we didn't. That's not true. And so we talked about this as a way to establish safety and as a way to think about being safe and feeling safe. And the mom asked directly, is that something we address? Like, when I'm listening, should I correct that and say that didn't happen? And so with certain things we'd want to and certain things we don't want to. So this doesn't really seem to be getting in the way of him being able to process this, and in fact is a way for him to feel even safer. But for example, if he said, the police never came and we stayed in that room and it never got solved, then we would want to address that because that is getting in the way of them being able to do things. It's dramatically changing the content of the story. So as with typical TF-CBT, we would address cognitive distortions that are maintaining symptoms within the narrative. Common distortions in traumatic grief. There's a lot of blame distortions, either self-blame or blaming others for events that are out of the control of individuals. Self-blame is a difficult distortion, I think, to deal with in trauma narratives in general, but particularly with traumatic grief. A lot of these kids didn't have a quite clear understanding of what death was to begin with, and this is their first experience of what death is. And so a lot of kids have the idea of, I should have done this, or maybe if I didn't get in a fight with my dad that day, he wouldn't have died in a car accident. They don't really understand what death is like. And we'll talk about the techniques you can use to help them get to a more adaptive thought. Blaming others, oftentimes they will blame any individual in their life, really, as a way of trying to understand how this could have happened to them. This is especially challenging if they're blaming another caregiver that you're doing the narrative with, and helping parents to understand how this is a typical process for children. This is normal. It's hurtful to hear that as a parent, but it's normal, and we're going to help them see things in a more adaptive way for your whole family. And then the last distortions are really changes in how the child will see other people or see the world. So things like nothing will ever be the same again. And so it's true that many things might not be the same again, but we would want to help children understand there are some things that will be the same. And also, just because they're not the same doesn't mean that they will necessarily be worse. And also issues related to how safe a child feels or how threatening they believe the world is. This will actually come into play as well with parents, because this will shift their own worldviews as well. So how do we get people to shift their cognition? If we tell them, well, that's not right? That's not a good way to think about this. Think about this in a different way. It doesn't often work. Instead, what we want to use is more indirect techniques to help someone reach their own conclusions. However, I would encourage you, before you try to address a cognitive distortion, try to understand what thought are you trying to get to. So if you don't know what thought you're trying to get someone to, you're going to get lost pretty easily in methods like Socratic questioning. And so what I always think of in my cognitive triangle is, here's the maladaptive thought. So nothing will ever be the same again, which is leading to feelings of sadness, which may be leading to behaviors like social withdrawal, which we don't want. Instead, I might want to get them to the thought that I'll miss some things, but some things will be the same. If I know there's a thought that I want to get them to, then I can help shift the way I'm asking questions to make sure that they're able to achieve this more effectively. And I just wanted to address that really quick. So someone had asked a question if they can get a copy of the PowerPoint, and I believe that will be made available to you as well with the recording. And then you can do this in a couple ways. So Socratic questioning is those open-ended questions to try to get someone to shift their perspective. So, okay, what things might be the same, or what in your routine has changed, or what hasn't changed. Best friend role plays can be really helpful, so helping kids to understand what would you tell your friend if they were saying that nothing is ever going to be the same? What would you tell someone else? And helping them to slowly correct the own statements that they're making to themselves. So cognitive coping and cognitive restructuring is something that takes a lot of practice, I think, as a clinician to be able to do effectively. And I know we've probably all had those sessions where we're like, well, that did not go the way that I thought it was going to. And that's okay. Remember that thought processes are constantly being restructured and changed. And so if it doesn't get changed in one session, you have another shot at it. That's a great thing about therapy. In most circumstances, you're going to have a second go of it. And so remember, these thoughts, a lot of times people are holding on to them quite tightly. So it's going to take a little bit of time to get them to shift their perspective. And so now we're going to move into, you've done the narrative, you've done the cognitive restructuring. What are the specific traumatic grief components that we want to be addressing? And so here they are listed on your slide, and then I'm going to go into them in detail in each one to help you understand how these are implemented with the case. So the first is just communicating about death. Hopefully, if you're doing your gradual exposure, this will not be the first conversation you've had about death in general. But what you're really trying to do first is gauge the comfort level of both children and parents in talking about death. This is trying to encourage communication between children and parents about this topic. So the first thing that I typically do is meet with the parent individually and ask them about their own cultural values surrounding death. So death is a highly cultural, personal experience. And what I don't want to do is give a kid a message that is in direct conflict with how their parents and their values are on death, because that's confusing and it's not being respectful. And so instead I try to talk with parents about, what is your conceptualization of death? What do you think happens? A lot of times that's religious values, spiritual values. And so for this kid in particular, the parents are of Christian faith and they believe in heaven. And so then I knew when I was talking to the kid, if he brings up things like that, or that's something that I could bring up with him as potentially helping him. And he did. He said that he's confident that his grandfather is in heaven and playing basketball, because for the last few years of his life, his grandfather wasn't very mobile and wasn't able to play outside with him anymore. And that was a really positive thought that he could come up with, that my grandfather is doing something that we love to do together. You can use different methods in how to communicate about death. Art is one I use very commonly in my session, making it a game to talk about it, so you can make up cards and then have kids take turns asking each other questions. So the parent would ask the therapist a question, the therapist can ask the kid a question, and making it an open dialogue. Remember, this may be a time when you need to bring back relaxation and psychoeducation reminders, because these conversations for most people are uncomfortable to have, even out of the context of a loss. And so when you've had a loss, it can be very uncomfortable for parents and children to communicate about this. And so you want to make sure you're being mindful of how things are being communicated in the room and encouraging parents and children to practice relaxation when they're starting to feel distressed. Then you would really move into mourning. And so oftentimes these people, they're already going to be mourning, but this is really directly addressing that process. So you would directly discuss the person who has passed away. This can be through drawings. This can be through storytelling. This can actually be a process very similar to the narrative. And what you want is really to elicit from the child, what are they going to miss about the person who is gone? How are they going to experience this loss and mourn this loss? And we want to make sure that they're thinking about what are the loss reminders in this life, because loss reminders are triggers for traumatic events, and we want to prepare them for how do you deal with your triggers. So first they have to know, what does remind you of this person? And in those conversations, I've found that oftentimes as clinicians, we cannot predict what will remind people of someone. It can be a scent. It can be a look that someone gives. And also remember that for parents, many times loss reminders are folded into their children. And so for this parent, she said it's hard because in so many ways he's like his grandfather. In so many ways, my child is a loss reminder to me. And helping parents understand how to really think about things like that and how to process those things and use their strategies that they've learned to cope with difficult events. Remember, really address parent and child grief here. And you also may need to address how parental grief contributes to child grief symptoms. So a parent, let's say, who is practicing avoidance, or they become triggered when positive memories are brought up. Remember, kids are watching parents all the time. And then kids then end up practicing avoidance and being triggered by things. This is a delicate conversation to have with the parent, though. And how I typically frame it is, I can tell how much this person meant to you by all of these things that I'm seeing. How do you think it might impact Tommy to see you crying at dinner time? Or how do you think that this is affecting him? And parents are usually able to say, you know what, I know that it hurts him, and I don't know what to do about it. And you can talk to them then about their own skills, as well as referrals if they need their own treatment. And I should have said that pretty early, actually, is many times parents will need their own individual therapy to cope with this loss as well. And that's something that we'd always want to facilitate through referrals whenever possible. Next, you'd really want to address ambivalence. So what this means is, excuse me, in most relationships we have in our life, we experience ambivalent feelings towards someone. So there are great things about relationships with people. There are not as great things about relationships with people. What tends to happen when someone passes away is this tendency to idealize the person. So everything about them was wonderful, which then can make someone feel very guilty if they have difficult feelings that are still left. This is particularly true if the death was a suicide or if the relationship was very complicated prior to the death. For example, what happens if the person who has passed away had also abused a kid before they had passed away, and how complicated then that loss could be. Oftentimes a great therapeutic tool is a letter writing task to the deceased individual, so you can have the child express a wide array of feelings. Just remember, you're encouraging them to express not only that I miss them, I love them, they were wonderful, they were fun, but also maybe, you know, I wish he would have been around more often, or he really did hurt me, or sometimes he was mean to me, and realizing that that's okay to say just because someone has passed away. And it can really invalidate someone's experience if we don't talk about the ambivalent feelings. This is a great time for psychoeducation. It's really normalizing for parents and children. This is a normal part of having a relationship with someone. And just because it doesn't make you love the person any less to have ambivalent feelings. It's just typical, and we'd want to express those. So that letter writing task for expressing those feelings can help kids develop closure and really be able to focus on growth. So we've been talking a lot about mourning the loss, ambivalence, but we also want to preserve the positive memory that we have with someone. Remember that a really key differentiation between uncomplicated bereavement and traumatic grief is how positivity is processed. For kids who have experienced traumatic grief, any reminders, even positive reminders, are problematic for them. And so we want to make sure that they're able to preserve positivity in a helpful way. So this could be a scrapbook, this could be a memory box. Oftentimes we try to make this a family activity, so it's a healing activity. So kids can go around to different family members and take things from them to put in their memory box. They can make a scrapbook together. Therapists are going to model, and parents are going to practice recalling and preserving these positive memories. And so therapists are going to ask questions directly of, what was fun, or what's the best memory you have with your parent? And the parents are also going to practice this at home of not only focusing on the negativity. I know with all presenting problems, we try to get parents to be balanced in their approach. And this is similar to that. We want parents to really be able to also bring up positivity with their children. Oftentimes also, parents can add areas to positive memories that kids are not aware of. And so an example that I have here is that a parent saying, your father loved you so much that he saved some money every month so you could get a car on your 16th birthday. So that's not something a kid would necessarily be aware of, but it's something really positive that a parent may want to share with their kid to make sure they realize, you were in this person's thoughts. They loved you a lot, and that can be really strengthening for a family. But unfortunately, with the grieving process, the relationship between someone is inherently redefined. So it's not the same type of relationship you had with someone when they were alive. And we call this moving from a relationship of interaction to one of memory. So now the relationship you have with someone is with memory. And we're really trying to help the children move towards accepting the death and transforming this relationship. One of my favorite exercises that they talk about is this 2-balloon exercise. So the kid draws 2 balloons, one up in the air and one close to the ground. And in the balloon, on the close to the ground, they write memories that they can still hold with them, that are still with them, things like memories of the event that's happened. And then up in the sky are things that they're not going to be able to necessarily do, things like talking with their parent directly, and helping the kids to see that you can still do some of these things in your memory, but it's not going to be the same. So not only do you emphasize to some aspects that have changed, but you also recognize the aspects that have stayed the same. And you encourage parents here to use past tense when describing the deceased. So therapy is a lot about language and the language choice that we use. And by having parents refer to someone in the past tense, it's helping children to understand that this person is no longer with us. And remember, one of the symptoms of traumatic grief is that children have a very hard time accepting that this death has occurred. And so one of the ways that parents can help a child to accept that this person is no longer around is referring to them in the past. So he was this, he did do this, versus currently. And remember, still, you're going to want to respect people's cultural values here, and so you can shift. If someone believes someone is in heaven, you can incorporate that in. So he still loves you from heaven. Something to the effect of helping kids to understand they are past if you're still going to use a more present tense with your language. I think this is a really important component of therapy next. This is committing to new relationships. So remember, these kiddos hold on to a lot of guilt about engaging with new people. What does it mean to start talking with my new stepdad? What does that mean about how I felt about my dad who passed away? So first is really acknowledging how the relationship with the person who is deceased has changed. And then you can talk about change in relationships and new relationships. You're really going to want to address feelings of guilt or betrayal dead on. So this is something that is very common for children to feel, and they're probably very ashamed of these feelings. So guilt is hard to bring about in a lot of kids. It's not something we want to talk about. We don't want to talk about the things that we feel guilty about. We don't want to talk about feeling like we betray someone. But a therapist openly talking about those feelings gives people permission to address them directly. Really emphasizing that the new relationships in your life, it's not competition. They're not meant to compete with your old relationships, and they're not meant to replace them. And this is helping parents also to make sure their kids understand that. So if there's a new person in the home, this person isn't to replace your dad or to compete with your dad. This is a different relationship in your life. And so another activity that you can use is something called a role list. So basically what you do is talk about the things that this person who was deceased provided you in your life. So he was the coach of my Little League games. He took me to ice cream every Friday. He was there to help me with math when I got home from school. And then talk about with kids, who can fill those spots for you? So who can be in your life to provide you with that support? Remember, it's not going to be the same. It's not meant to compete, but it's to help you understand that your life doesn't have to stop, that you can get these things from other people. And remember that oftentimes parents are also isolated, and parents are also withdrawn. And they're modeling this for their children inadvertently. And so we also want to encourage parents to build new relationships as well. This is a way of showing their child through their actions that it's okay. It's okay to love again. It's okay to meet people again and form relationships, because we know social support is really protective, not only for PTSD, but for depression, for behavioral symptoms. Across the board, it leads to an enhanced quality of life. And we'd want to make sure that kids have those relationships modeled for them with parents. And then we'd focus on meaning making, just like we do in the trauma narrative with that last chapter. So how has this experience, though difficult, helped you grow in some way or become stronger in some way? And I know this may seem counterintuitive to some people. Like, how could this experience, it was really difficult. Why do we want to be focusing on growth or strength? And people can find all sorts of answers to this question. So some children discuss strength in themselves. So I'm stronger than I knew I was, or I didn't think I could do it, but I can do it. Some talk about stronger relationships with other people. So, but now I'm really close with my mom, or I'm really close with my grandma. Or what I found really commonly is they they talk about their ability to help others in a similar situation. So if another kid was going through this, I'd know how to help. Or maybe I'll be a counselor one day and I'll help kids who have lost someone important. And what you'd want to do is not only elicit these statements from people, if you want them to talk about it, you want them to do it. So find activities that strengthen these notions in themselves. So if kids feel like, now I have a better relationship with mom, we really want to be encouraging, mom, keep up this better relationship. Do these activities with your kids because this is important for them. Or if they say, I can help other people now, maybe they'd want to donate time to a charity in honor of somebody that has deceased. Maybe they'd want to contribute to the charity of an illness, let's say of someone that's passed away. That's important to them. And so meaning-making is really not about forgetting what has happened. It's about making a different meaning of it so you can live your life and continue to live your life. I tell parents often that the point of this is not to move on from someone. It's to move with someone. So how do I move forward with this person versus move on from them? So a lot of people feel guilty moving forward, that means you didn't love the person enough to be sad still. And so this is about showing them that you can still carry someone and then be okay. Termination. So when we're getting ready to terminate with these kids, oftentimes they talk about the 3 Ps of termination for traumatic grief. The first is prediction. So predict difficult times in the future that are going to happen for kids. Things like birthdays, things like holidays. A young girl maybe will feel the loss of her father on her wedding if she was expecting him to walk her down the aisle. Or maybe a boy will feel the loss of his parent at his first basketball game when they would have been in the bleachers. And so you want people to start predicting these times, and even something like making a calendar of these times that'll come up that parents and children can do together. Then what you're going to do is the second P is prepare them for those future events. So when that happens, what are you going to do as a family? And so many parents find that it's helpful to create a new tradition that respects and honors the person with them, but also helps you move forward. So if let's say mom was always the one who cut the turkey at Thanksgiving, and so now when the turkey comes out, it's going to be a trauma, it's going to be a difficult time. Maybe that can be a new thing, like everybody thinks about mom for a minute of silence, and then they cut the turkey together. So something like that, creating a new thing to take the place of an old thing that's respectful. And the last P, which I think is really important, is permission. So it's allowing ourselves and those around us to experience grief in different ways as time progresses. So grief is a long process, and it's a different process for everyone. And so In some days, you may wake up feeling great, and other days it may be really hard. And so helping kids to understand that if you start to feel this way again, it's okay. That's normal. This happens. You have tools to help you work through that, and similarly with parents. And really, remember, terminating therapy is another way of ending a relationship. And so oftentimes you can use that as an opportunity to discuss loss in a different context. So losing your therapist is losing a significant relationship in your life, not to death. And so helping kids understand the idea of relationships sometimes come and go in your life, and that people can be meaningful for you, even if it's not a permanent relationship. And again, always encouraging the use of services if needed in the future. And so what I tell parents is you've learned a lot of these tools, have confidence in your ability to use them, but if you need help in the future, please don't hesitate to come back. And what I'm going to do is read you these couple quotes. The first is from Alicia Lieberman. She's pretty prominent in the trauma field. She's someone who's involved in child-parent psychotherapy, CPT, which if you're familiar with the Arkansas NEST program, that is one of the treatments that will hopefully be in dissemination as well. It's for children 0 to 5. And what she says is we need to know that children always remember. The question is how they remember. And so this idea of directly tackling memories from someone and helping them to shift the way they think about things. And Robin Goodwin, who's also a prominent grief researcher, said, you know, one of the best things you can do for these children is help them realize it's okay to remember the way the person died as well as who the person was. And like we know, much of trauma work, if we could all have a magic eraser and erase these negative events that have happened to children, it'd be great. But unfortunately, we can't. And so instead what we want to do is help people to make sense of their memories and make sense of the emotions that they're feeling. So what I've included here, and remember you'll have a copy of these slides, is some really helpful resources when you're thinking about treating traumatic grief. So the first is the creators of TF-CBT, so Dr. Cohen, Dr. Manario, and Dr. Deblinger. They have a book out called Treating Trauma and Traumatic Grief in Children and Adolescents. If you don't have this book and you're doing TF-CBT, you're making it harder on yourself. So it's a really, really great resource, and I encourage you to pick it up regardless of if it's a traumatic grief case or not. I open up this book all the time when I'm preparing for sessions, and I really encourage you to get a copy. The NCTSN network has a whole section on traumatic grief. It has some really helpful parent handouts that are in English and in Spanish that are really helpful. There's the Courage to Remember curriculum guide. This was something that I referred to a lot as I was creating this presentation for you. I've included the link for the PDF here. It really takes you through how we do TF-CBT and then how we do these grief components. It has great activities, great handouts, great reminders. So that one really definitely make sure you look into that. It's free, and it's really a useful clinical resource. A lot of us do psychoeducation through books, and there's a book available online called Ready to Remember, Jeremy's Journey of Hope and Feeling. And it's a psychoeducation book about caregiver loss. I've used it with a lot of my kids. The illustrations are great. I think they really address a lot of the ambivalent feelings and the process of therapy. I think it's a really helpful resource. And finally, there's also a video called It's Okay to Remember. This one's a little bit longer of a video, and so I don't know whether you necessarily want to do it in sessions. If you're really having a family that's having difficulty, perhaps it is worth doing it in session. If not, if a parent has access to the internet, they can always look at that video at home. It really discusses childhood traumatic grief and also talks about the goals of traumatic grief therapy, and that remembering is okay to do, and it won't necessarily lead to negative symptoms. And so that's basically kind of the presentation that I had outlined for you all. What I'm hopeful to do is if you have any questions about the process in general, please feel free to ask those now.
Thank you, Sethna, for such a great presentation. Yeah, if you have a specific question, feel free to type that in, and we will answer those as they come in. So while people are maybe writing, I just wanted to, in the September webinar, we're going to be talking about how to start and end TF-CBT with kiddos. So we're going to have some great examples of engagement strategies, and then as well as some interesting kind of graduation ceremonies that different therapists have done. So that's going to be September's webinar, is starting and ending TF-CBT. So again, this is kind of the end of the presentation. We will stay on for a minute or so. If you have questions, please type those in. Otherwise, thank you for joining us, and I will email out this presentation later on this afternoon to everyone who's on the call. So feel free to write in questions if you have those.
Yeah, thank you very much for your attention. Hopefully this was helpful for you in your clinical work.
Okay. We've got a couple, let's see. Oh, just lots of thank yous. Okay. And Safna, they can't see the questions, so you have to restate it.
So there's a question of, do you find that there is one section of the process that takes a significant more time than the others? I think that's a great question. So a lot of these modules for childhood traumatic grief can be combined in a session, and so sometimes the communicating about death, for example, that module can be combined with the next. It doesn't necessarily take a whole hour of work. What I found is universally the narrative is going to take more work. So the narrative in general, we recommend at least probably like 3 to 5 sessions of work is oftentimes what the narrative takes. But as well, when we're talking about mourning the loss, so that's a session where you're really talking about the person directly. It's a process similar to the narrative. That one usually takes me at least a couple sessions. So I don't think I've ever done a mourning the loss session in one session. But use your own clinical sense here. So you've worked with this family now for a while. If there are areas that they're particularly struggling with, that's likely a session that's going to take longer. So if they've had trouble making relationships in their life, that might be a session that'll take longer. Or if they have a lot of ambivalent feelings about the death, so if the kid had a really complicated relationship with the parent prior to the death, that might be a session that takes a longer period of time. And so TF-CBT is pretty flexible in that it allows us to really focus and tailor things to what our patients need.
Okay, Cherry, I see that you got your hand raised. If you have on this webinar thing, if you have a specific question, why don't you go ahead and type that in. We'll try to. Okay. All right, so we'll stick around for a little bit longer if folks have other questions. Okay, we have another question come in.
That's a great question. So someone asked, have you done this with older teens? Any advice with that or avoidance in general? And so older teens, what I have found is the main areas where things are different is cognitive coping. So older teens are a lot of times much more able to do cognitive restructuring at a higher level and to understand these things. For little kids, cognitive coping might be them just recognizing that a thought is unhelpful and really providing a lot more guidance into achieving a helpful thought for them, even sometimes giving them the words to repeat to themselves in self-statements. Older teens, though, I do a lot of cognitive distortion work. And so there's some great handouts that list a lot of cognitive distortions, like blaming cognitive distortions, overgeneralization, all or nothing thinking, minimization, catastrophizing, just your basic CBT distortions. I do a lot more work with them on those distortions. Similarly, older teens, simply for a fact that they've been around longer, are likely, or more likely rather, to bring in a previous trauma history. And so because of that, the narrative might look more like a timeline for them, or the death may not actually be the most impairing trauma symptom or traumatic event for them. So with older teens, I think they're very capable of doing this treatment program. It would just be about making sure that this is the trauma that is impairing them or doing a lifeline. With addressing avoidance in general, I'm not sure if the question was directed towards avoidance in terms with older teens or just avoidance in general. So I'm going to answer avoidance in general. Hopefully that'll cover both. For me, one of the ways to address avoidance is to talk about why we're addressing avoidance. Sounds a little silly, but a lot of times people are avoiding something because it's painful for them. Exactly. They don't want to go through the process. They don't want to cry in front of somebody. And so what I talk about is that this process of talking about things out in the open is like cleaning out a wound. A lot of us use this wound example, and I think it's really helpful for families. Excuse me. So what we tell people is you have a wound right now. And what I could do, I use a splinter. So you have a splinter in your finger. What I could do is just chop off the top of the splinter, right? I could teach you these strategies but never actually talk about what happened. That'd be avoidance, but you wouldn't heal. And in fact, you might get infected and things might get worse. What I need to do is dig down deep and remove the whole splinter. We need to actually talk about what happened in order to help you gain control. Right now, the memory has control and the feelings have control. I want you to have control. And eventually, there's going to be a scar. There's always going to be a reminder of what happened, but scars don't hurt when you touch them. So right now, your open wound, it hurts when we touch it. That's why you're avoiding it. It's normal to want to avoid it. But we're going to dig it out so that way when you touch it, it doesn't hurt anymore. And that can help people to understand why combating avoidance is so important. So if you look in someone had asked about worksheets. If you look in the Childhood Traumatic Grief Curriculum Guide, there are a lot of worksheets to go through, as well as the TF-CBT. I'm not sure, Chad, if these are on the ARBEST website, those TF-CBT workbooks for adolescents and for children. Chad said you can email him. They have a lot of worksheets on how to go through all the modules of TF-CBT, and there are different workbooks for children and for adolescents. So hopefully that is helpful for you.
Okay, we'll have time for one more question, because we know folks have got to get back to the rest of their Friday. So if you have one more, we'll take one more question if anybody has one. Going once? Going twice? Okay, well, you all have been a great audience, and be looking for the email later this afternoon, and thank you for joining us.
Thank you so much. Take care.